Hello everyone, welcome to my channel. Today I will help you differentiate between the symptoms of the COVID-19 disease, that is the novel coronavirus infection, from the symptoms of the seasonal allergies. And I have extracted this information from the World Health Organization, Center for Disease Control and Prevention, and from Asthma and Allergy Foundation for America. Keep watching. Before we get into the point, let's find out what are the symptoms of the COVID-19 disease and the symptoms of the seasonal allergies in general. First of all, COVID-19 disease. The most common symptoms of the COVID-19 disease are fever, cough, with or without the sputum production, and the shortness of breath. Other symptoms are fatigue, sore throat, muscle pain, also known as myalgia, joint pain, also known as arthralgia. In addition to these symptoms, the patient also develops the gastrointestinal symptoms, that is digestive symptoms. They are anorexia, diarrhea, nausea, and abdominal pain. Seasonal allergies. Around 20 to 30% of the global population are affected by this disease. These allergies means the immune response that is produced when the body is exposed to the particular allergens. That can be either pollen, dust, molds, or anything. The symptoms of the seasonal allergies include sneezing, runny nose or the stuffy nose, watery or itchy eyes, itchy throat or itchy ear canals, ear congestion, postnasal drainage or postnasal drip. The less common symptoms include the headache, the shortness of breath, coughing, and the wheezing. Wheezing means a typical kind of sound that is produced during the expiration and is usually heard through the use of the stethoscope. Why is it important to differentiate the symptoms of the COVID-19 disease from the symptoms of the seasonal allergies? Because the seasonal allergies peak in the spring, summer, and early fall when certain grasses, trees, weeds, and the fungi boom. Unfortunately, this year's season coincides with the coronavirus outbreak. Hence, it's important we differentiate between the two. Now, let's begin with the differentiating factors between the symptoms of the COVID-19 and the symptoms of the seasonal allergies. Number 1. Fever. Fever is a response that appears to enhance the immune function and inhibit the pathogen growth. In this case, the pathogen is a novel coronavirus. That means the novel coronavirus can cause fever, usually temperature more than or equal to 100 degrees Fahrenheit, while the seasonal allergies cannot produce the fever. Hence, if you have a fever, it is less likely it is because of these seasonal allergies. Number 2. Itchiness. It's another major distinction between the seasonal allergies and the COVID-19 disease. The itchiness is a hypersensitivity of the immune system to typically harmless substances in the environment. So, the seasonal allergies comes with some level of itchiness. Example, itchy eyes, itchy throat, or itchy ear canals. While the novel coronavirus will not produce itchiness. Number 3. Shortness of breath. Shortness of breath is produced when there is infection of the lung, and the infection of the lung is a common feature of COVID-19 disease. Hence, in around 20% of the patients with the COVID-19 disease have a shortness of breath, while the allergies do not cause the shortness of breath. There is an exception to this rule that when allergies trigger asthma, there can be shortness of breath. Hence, history of asthma is also important to differentiate between the two. Number 4. Sore throat or body ache or fatigue. The quick onset of the body ache or pains or fatigue, exhaustion or weakness is unlikely with the seasonal allergies. While the allergies can cause fatigue, it is usually very gradual, not hitting you like a ton of bricks as has been described with the viral infection. Hence, these features are more suggestive of the COVID-19 disease rather than the seasonal allergies. Number 5. Production of the mucus and the runny nose. The production of the mucus in the runny nose is likely because of the seasonal allergies and not because of the COVID-19 disease. The mucus in case of the seasonal allergy is typically clear, but if you see a yellow or green colored mucus, it's likely due to a viral infection. Number 6. The duration of the symptoms. The duration of the novel coronavirus infection can last a few weeks, whereas the duration of the symptoms from the seasonal allergies can last longer than that, usually throughout the season and in some cases throughout the year. Number 7. Aggravating factors. The seasonal allergies have aggravating factors like exposure to the pollens, dust, mold or mildew. This increases the symptoms which are relieved by over-the-counter medications and other regular health precautions. No such aggravating factors is seen with the COVID-19 disease. Number 8. Digestive symptoms. The digestive symptoms is a common feature of the COVID-19 disease. Around 48.5% of the patients with a novel coronavirus infection have these features. They include anorexia, nausea, diarrhea, or abdominal pain. And there is no gastrointestinal manifestation in patients with the seasonal allergies. Number 9. Past history. History of the similar symptoms or illness in the past during the same season is a peculiar of the seasonal allergies. For example, if you are typically a spring sufferer, you can expect to suffer from those snuffles this spring too. Number 10. Other relevant histories. In case of the COVID-19 disease, history of recent travel of yourself or anybody in your home or school is important, and history of living in or traveling in an area where the outbreak of the novel coronavirus infection has occurred is important. That's the end of the video. I hope this video helps you to differentiate between the symptoms of the COVID-19 disease from the symptoms of the seasonal allergies. If you like this video, don't forget to like, share and subscribe to my channel and hit the bell button to get notified every time I post a video.